Hi, my name is Jamie, Miss Hot Lady J. At least I will be when I get through with my surgery. I'm coming to you because I'm having the gastric sleeve surgery, and this is my introduction. I am 33 years old, a wife and a mother of six, and I'm having the gastric sleeve is because I want to be healthy. I just want to be a healthy weight so I can move and be able to do things with my children and, be able to just be active and just healthy. And so, because I do have high blood pressure right now, and I think for the age of 33, I don't think you should have high blood pressure. And so, I think, dealing with the weight issue and things of that nature, that's, a lot reason why I have high blood pressure. And it does run through my family, and diabetes does too. And so, and I don't want to get diabetes, so that's why I'm having the weight loss surgery too, because I really want to end the cycle. I want to feel better and eat better and teach my kids better habits. And so, in order to do that, I need to do this. And so let me start from the beginning. I am a Kaiser patient, and this has been about a year since I started. Back in November of '09, I told my doctor I wanted to have the weight loss surgery, but I didn't, know which one I was going to at that time. But so I told her that, and so she said, well, we have to send a referral over. They love to do referrals at Kaiser. And so I got a referral to the bariatric clinic, and so I didn't hear from them, all of November and all of December, and nor January. She told me it may be a while, because she said, they're really pretty booked. And I'm in Southern California. And so I finally called them on February 25th. The case manager told me, hey, class was today. We had one today. You already missed this class. I said, oh, okay. I was like, asked her what was the next class. She told me the next class was March 25th. I said, so, I'll come to that one. So I booked that one, and I went, and they told us about everything. They told us we had to do a 12-week class. Told us that we needed to lose 10% of our body weight. They told you all about, they told you somewhat about the surgery, but they went into more detail at the class. And so she told me it would be a while before we get into the class, maybe July of August, because, they were pretty booked. And so she said, and don't expect your surgery to come up until 2011. So that was kind of like a bummer. And so I said, I'm going to have to beg these people. I'm going to have to bug these people because I want the surgery this year. I want it done, and I want it done as soon as possible. So I waited all April, and I called in May, and I said, I'm trying to get into your options class. I already attended your seminar. What's going on? And she said, well, we are thinking about adding classes in June. Call me back in about a week and let me see what I can do. So I called back in a week, and then she told me I had to come and see the doctor before I could get into the options class. You have to see a bariatric doctor to tell you, hey, if you're okay enough, because you have to take an EKG and things like that to see if you're okay to have surgery. Because if your heart is not okay, they will not even consider you for surgery. So you can't get that options class. And so I did that. Everything came back okay. I talked to him on June 1st. I talked to him on June 1st. And I went and sat down with her, and I asked her, I said, so when is your next class starting? And she said, well, just so happened we have some class starting on June 21st. And I said, okay, I'm not doing nothing else. I'll start then. And she said, well, most people will, I'll start then. I started on June 21st. We had a class full of about 25 people that first day. And we went through the class, and we graduated on September 21st. When we got through, 10 of us graduated because so many people dropped out and things like, had other things, and people moved to different classes and stuff. And so about 10 of us graduated. It's a long, grueling 12 weeks. And I know you're saying June 21st and September 21st, but the reason why we had to go 2 weeks because we had 2 vacations during that time, that we, in our 12-week session. So we actually went through like a 14-week thing. But anywho, but they taught you a lot. And I'm glad I had to go through that class because it taught you how to eat, how to, make meal plans, and how to eat right, and how to read labels, and you should shop on the outside of the store. And it told us about all the surgery, the lap band, the disadvantages of the lap band and the advantages of the lap band, the sleeve, the disadvantages of that one and the advantages, and the room wide and the differences and the advantages and the disadvantages of that one also. And we tried protein shakes, and she let us try vitamins and all that good stuff. And so I really liked the class, and I'm glad I had to take the 12-week class because, when you're not in the know for something and you're going to get something done, sometimes you don't know what you're getting yourself into. And so you be like, dang, I wish I wouldn't have done that. I know the weight loss is like, okay, I really want this done, but I'm glad I had to take the class first. And the class was very educational. It was taught, and you just learned a lot, how to keep food logs, and to see what you're eating every day, to see why you're putting on the weight, and exercise logs is, and so okay, I worked out this amount of time today and this amount of time. And so you have to turn all them in, and you've seen the weight come off. Because let me start with my weight. My highest weight was 348. And I don't know if that's because I was pregnant, but when I was pregnant, I was 348. But when I started the options class, I was 333. And by the time I got out of the options class, I was 301. And right now I'm currently 295. And so I graduated that class on the September 21st. Prior to me graduating, I called my case manager and I begged her for an appointment to see the bariatric clearance doctor one more time, because you got to see him again before you can get cleared. And so I seen him. I begged her, and she got me an appointment for September 27th, and I told her I'll be there, and which is rare, but it can be done. That's why you got to need to make your case manager your best friend. And I told her I was going to bug her until, I get something done. So I went to see him on September 27th. Prior to that, I had to take a lot of tests. But people don't tell you on YouTube. I took about 35, 36 tests, dealing with all your vitamin levels, your CBC, I had to take another EKG. I had to take a chest x-ray, and everything. And so, I seen him September 27th again, and I didn't get cleared that day. I didn't do the chest x-ray right off the bat, and so I had to go do the chest x-ray. The chest x-ray takes about a week, so when you have to get your chest x-ray done, please get it done, because if you don't, you'll be waiting another week. Okay, and so I got the clearance. Everything else came back okay, and everything, and I got my clearance. And so she told me she had to send a referral over for the authorization to have the surgery, and that takes about a week. So we're back. I already waited to another week after the 27th for that, and then another week to get the authorization. And then she called me on October 8th. It said the authorization is not in yet, but I could get you to go to this new place in Ventura. It's not a new place to Kaiser, but she found out that Palmdale can send, and Lancaster can send their patients to this place in Ventura, that Ventura Kaiser has already been using, but we haven't. And so because I was originally going to San Diego, because in the class they told us it was quicker to go to San Diego and get your surgery than it would be anywhere else that Kaiser contracts with. Palmdale Lancaster was about, they said 12 weeks after we finished our class. West LA was about 4 or 5 months. And so I was like, no, I'm not going to wait till next year, because you never know what's going to happen. You never know if you're going to lose your insurance, you're going to lose your job, so your insurance is gone. You just don't know. So I said, I'm not going to wait. And so I told her that day, I said, give me both numbers. I'm going to call on Monday, find out who has the shortest wait time. I called on Monday. I called Pacific Bariatrics, that's in San Diego, which, came highly recommended. I asked them their wait time. She told me that first you had to attend their seminar, which their next seminar was October 20th. Didn't want to wait for that. And so I was like, and she was like, well, then after that, you have to get an appointment with the doctor, which would be about 2 weeks out after you attend the seminar. And then she said that you see the doctor, and he evaluates you. He talks to his team, and then that takes about 3 weeks to do. And then after then, you get another appointment to come back, and then that's when you get your surgery date. And I said, so when are you scheduling for? What's your schedule now? What month are you scheduling? She said, we're already scheduling January and February. I was like, no, can't do it. I don't want to wait that long. I was hoping and praying, so I said, let me call this Ventura place, and it's called Ventura Ventura Advanced Surgical Center. I'm thinking I'm saying her name right. And his name is Dr. Billy, and I called his office, and I spoke to a lady named Becky, and she told me, if you can get your authorization over here today, we can squeeze you in on Wednesday to have an appointment with the doctor and perhaps get your surgery date. And I was like, if everything checks out. And I was like, oh, okay, well, let's do it then. And so I scheduled my appointment for 2 o'clock on Wednesday, and I went. Filled out all the paperwork, made sure that my case manager faxed over all the information, and everything was set. Okay, and I went there on Wednesday, and I saw him, and we spent about an hour together. We talked, and he told me the pros and cons and the disadvantages of the Roux-en-Y, because I was still on the fence. Didn't know which one I was going to get. And he told me really difference is with the malnutrition, that was a disadvantage of the Roux-en-Y. And, and he told me that with the sleeve, the disadvantages is, what the major disadvantages is that you may lose 10 or 15 pounds less than you will if you had the Roux-en-Y. And I was okay with that, because I say, if I am between 60 and 170, I'm okay. 175 is fine with me too. I just want to really be healthy. And so I said, I'll take the sleeve. I just didn't want the hassle of the Roux-en-Y and the malnutrition, and no, I just didn't want to do that. And so I said, let me do that, the sleeve. And so he was like, well, how soon do you want your surgery? And I said, as soon as possible. And he said, well, how about Tuesday? And I said, I'm free. And he said, okay, well, let's do it. And I said, well, let's do it then. And so they scheduled me for Tuesday, October 19th. And I'm kind of nervous. And I just, he told me that day I had to start my PreOp diet. So that's what I'm doing right now. I'm doing all my PreOp diet. And people are on YouTube saying it is easy. And it may be easy for them, but it's not easy for me. I can kill for some nice cheesecake right now, but I'm not going to have it. And I just can't wait to have my surgery so I can start my, weight loss journey and everything. And I've been on the PreOp diet since Wednesday, because he asked me to do anything that day, and I told him no. And so he said, well, don't even eat nothing, and just do the liquid diet since for there. So that's what I've been doing. I got the liquid diet started, and I'm just doing that. And like today, I tried to go walking and stuff like that, but I had this real bad cramp in my stomach, like hell. And I'm like, I don't want to push myself. So I just said, I'm just going to lay out the exercise until after I have the surgery and the doctor clears me to exercise, because I don't want to faint out there or fall or anything like that, or having excruciating pain, because I am, and I've tried to work out ever since. And I don't know if it's because, I'm on this liquid diet, my body is saying, hey, you're already losing weight, so don't even try to exercise, because we're not going to do it. But anywho, I got to end this thing because it's going on 15 minutes. So I'm going to make another video tomorrow, the night before my pre-op, to let you guys know how I'm doing it. And so see you tomorrow. Thanks. Bye-bye.